Hi, Dr. Lingerfelt. I'm
Hi.
Dr. May.
Nice to meet you.
Nice to meet you. We're so happy to have you at State of Franklin Healthcare, and I'm glad that you're coming to my hometown. Tell me a little bit about yourself.
So I'm originally from Unicoi County. That's where my husband and I grew up, so not too far from here. I went to high school over there, played sports growing up, and then I went to ETSU for undergrad. That's where I got my college degree. And then I ventured a little bit away from home and went to Spartanburg, South Carolina for medical school. And I just found it was too far from home. Wanted to come back this way, so I went to ETSU in Kingsport for my residency with family medicine.
Awesome. We're really happy to have you. I'm from Elizabethton here, and actually did kind of a similar journey as I was in the first part of my career as well.
Oh.
So I know that you're really going to like it coming back home.
Yes. Yeah, we're back in our mountains, which is where we want to be.
Great. Now, I went to OB/GYN, but you did family medicine.
I did.
Tell me a little bit about that.
Well, so when I went into medical school, I initially thought I wanted to do pediatrics because I'm a big kid at heart. I can relate to kiddos very well. But when I went into medical school and started doing rotations, I did my geriatrics rotation and found that I absolutely loved it. And so then I thought, well, what in the world am I going to do? So I started looking at my options, and family medicine just had everything. It had pediatrics, it had geriatrics, it had chronic care management. I am an osteopathic physician, so I can do hands-on techniques and things like that. And I found family medicine was really easy to incorporate that into. And so through multiple different rotations through medical school, it was like, I love everything. What's a good fit? Family medicine was that right fit for me.
That's awesome. I kind of found the same experience going through medical school. I thought I would be a family medicine doctor because I thought they were the quote real doctors. I found I liked surgery. I ended up doing a field where I could do a lot of different things and do surgery as well.
Mm-hmm.
But that's really great. And I know that you have decided to move here to Elizabethton, my neck of the woods.
Yeah.
So we're very happy to have you. Are there any special things that you do or that you do differently maybe than other physicians?
Well, I like to be really hands-on. Like I said, with osteopathic medicine, I like to be more hands-on with my patients and offer them OMT, which is really not that common, even though it's been around for a long time. So I get a lot of questions about that, but it gives me a chance to be hands-on with my patients. I also really enjoy doing procedures, so I like to do different types of skin biopsies, things like that, which I think is helpful, especially with trying to get into specialties and things like that. It can take a while, so that's something that I might be able to offer my patients. I come from a sports background, so I like joint injections and things like that to help with those sorts of things. And then also women's health procedures I enjoy doing.
Great. Elizabethton High School is right across the street.
It is.
There's a lot of those kids are going to be needing some help with the sports injuries and things like that.
Absolutely.
So we're glad to have you for that as well. Is there anything else you'd like to tell me about your practice here?
Well, primary care of Elizabethton is a little bit unique in that it is a primary care clinic, so I'll get to see patients and follow them all throughout their journey. But we also offer walk-in services. So if you have something acute that comes up that day and you need to be seen, we want to be able to give that care and provide that resource to the community as well. So we're a little bit of a hybrid in that standpoint. But I think that's going to be really beneficial for patients to be seen same day if they need it, but also have a consistent doctor that they're seeing every visit that they come in.
That's great. You're going to be very, very busy. Are you going to have any
Hope
helpers?
so.
I hope so too. Are you going to have any helpers?
Absolutely, yep. We'll have Tammy Wilhoit, who will be our nurse practitioner here.
Great.
And I've met Tammy several times. She's fantastic from what I hear and has a lot of experience. And then also we will have Dr. Thompson, who will be coming as like a PRN provider. So he has a military background. He also has a ton of experience, especially from a walk-in standpoint side of things with that acute care. So he will be here intermittently. And then we've got a great nursing staff, front office staff. Everybody that I've met seems wonderful.
Great. Well, you joined a great group. State of Franklin Healthcare has been around for decades, and I would argue they're the premier healthcare organization in this region. So you have plenty of backup all across the region that can help out. And I expect you're going to be very busy, and unfortunately, you're not going to have much time.
That is okay. I'm ready to go.
Awesome. Well, welcome to our community.
Thank you.